Hello, everyone, and welcome back to our series on high blood pressure. So, last week we talked about how to check your blood pressure properly. And so, I'm going to now tackle another question that I hear all the time, which is why does my blood pressure seem to change every time I check it? So, I've heard this from patients a lot. One day they check it, it's one number, maybe it's normal. And then the second day they check it, it's high, or maybe even within the day, it goes up and down a lot and it bothers them. So I'm going to address that today. What's going on? Let's break it down. So if this is not the case for you, maybe you already know you have high blood pressure and you just want to learn more about what you could do to lower it, I have something for you too, so keep listening. I'm Dr. Lola Ashaye. I'm a board-certified family medicine and lifestyle medicine doctor and owner of InTouch Primary Care in Sugarland, Texas. And you're listening to Connecting the Dots with Dr. Ashaye, which is a great place to be if you desire to take charge of your health so you can live fully while enjoying doing what you love. Okay, so why does your blood pressure change? Why does it seem to go up and down? First, it's important to understand that your blood pressure is not supposed to be the same all the time. It's naturally going to go up and down throughout the day. It depends on what you're doing. And that's good because that means your body is actually adapting to what it needs. So when you're stressed, when you're active, your blood pressure is going to go up. When you're relaxed, when you're sleeping, your blood pressure is going to go down. The problem is when it's always high, right? So if it's high when you're resting, then that's when the problem is because now your body is always under stress. That's how the body feels, like it's always under stress. So as I mentioned earlier, we're going to talk about the factors that affect your blood pressure so that if you have this issue of your blood pressure going up and down and up and down and you're having difficulty figuring it out, listen and you'll learn more about things that you may need to look and check and see if may be affecting your blood pressures. Okay, but before we go further, if you want to keep learning simple ways to improve your health, go ahead and hit that subscribe button, join our community, and so that we can continue to share more practical tips. And it helps others hear about us, the more people that subscribe and it helps people learn this information. And so if you find it useful, go ahead and subscribe, go ahead and share, go ahead and like. Also, like I said, for those that have high blood pressure and you're interested in learning not only about, ways you can naturally lower it, but you want to figure out, okay, what kind of supplements? How do I know this is a good quality supplement versus not? I have something for you. You can go ahead and check out our guide by clicking on the link in the caption. And it's a guide about 5 supplements that can lower your blood pressure naturally and how to choose them. So always talk to your doctor, though, before adding supplements to the regimen. And if you need more information about that, especially if you're in the Texas area, you can always book an appointment with us and we'll be happy to walk you through it. Okay, so what factors affect your blood pressure? So what are the biggest reasons your blood pressure may be fluctuating? Number one is time of day. So your blood pressure is usually lowest in the morning. So after you wake up, it'll be lower and then it gradually tends to increase throughout the day. So the evening blood pressure is typically higher, and that is not unusual, right? So that's number one to keep in mind. So if you check first thing in the morning before eating or drinking anything, it probably will be lower than if you check after you start moving around and eating, and after you've eaten, after you've you've had something to drink, especially if you've had caffeine, right? So we talked about that last time. Make sure it's been at least 30 minutes after your caffeine before you check again. The evening blood pressure, if you check after a long day, if you've been eating anything salty, if you've been stressed at work, blood pressure is probably going to be higher. So those are factors that can affect. So it's important when you're trying to get a good idea of what your blood pressure is that you pick around the time of the day that you want to check so you can see a trend and stick to it. So if you're always checking in the morning, then you know that you're looking at the morning trend. versus if you're checking in the evening. That way we get a better idea of what's going on. Okay. Now, the second thing that can affect your blood pressure is your eating and drinking habits. So if you had something salty, that will directly affect your blood pressure. Caffeine, even just 1 cup of coffee, can increase your blood pressure by 5 to 10 points for up to 3 hours. Okay, so energy drink can also increase your blood pressure because it has caffeine in it. Alcohol will initially lower your blood pressure, but over time, if you keep drinking alcohol, it's going to raise your blood pressure as well. And sodium, most of us know that, especially if you eat something late at night, your blood pressure may be a little bit higher than it would normally be because you're retaining some fluid. So you may want to check and see, what did I have to eat or drink before when you check your blood pressure? If it feels like it's all over the place, you may want to track what you're eating and drinking as well. The other thing to note is even your movement, your physical activity will affect your blood pressure. So when you're moving around and your blood pressure is going to increase versus when you're at rest. So your blood pressure could be even 10 to 15 points higher for a few minutes after you walk up the stairs. And then when you sit quietly for about 5 minutes, then it would kind of come back to normal. So that's why it's so important that before you check your blood pressure, you don't do something physically active and then just sit and then check your blood pressure right away. It's going to be inaccurate. So you always want to kind of make sure you have been sitting down for about 5 minutes before checking your blood pressure. Okay. The other things that can affect your blood pressure is just stress, anxiety, and then some people have what we call white coat syndrome. So their blood pressure they just feel stressed automatically when they're in the doctor's office or in a healthcare setting. And because of that, the body releases hormone called adrenaline, and that temporarily raises the blood pressure. So this can cause people to have, an elevated blood pressure, which may not be necessarily accurate. It may not be necessarily that the blood pressure is always that high. It may just be situational. And so in those instances, it's important for the person to try to calm themselves down. They can do deep breathing, or they may need to check their blood pressure when they feel more relaxed. Another thing that can affect that some people don't necessarily are not aware of is if you have a full bladder. So if your bladder is full, it can raise your blood pressure by 10 to 15 points. So before you check your blood pressure, make sure you empty your bladder, go to the bathroom first, and then sit down for 5 minutes and then check. Okay. Now, the last thing I'm going to address is sometimes your blood pressure can be incorrect because you are not checking properly. So we talked about making sure that your feet are planted on the ground. So if you're crossing your legs one time and then you're not crossing your legs the other time, crossing your legs can raise your blood pressure by 5 to 8 points. If you're using different blood pressure machines, so let's say you're using one with a small cough one time, another time you're using one with a bigger cough. When you use a blood pressure cuff, the part that goes around your arm, if it's too tight, it can increase your blood pressure. And then obviously, if you're talking while you're measuring your blood pressure, it can increase your blood pressure up to 10 points. So how you check your blood pressure is important. And you can check out our last episode to figure out more about, how to make sure you're accurately checking your blood pressure. Okay. So I hope that has helped. We can just summarize with this. So your blood pressure naturally fluctuates. It's supposed to do that. That's okay. But if you want to get the most accurate readings, try to check about the same time every day. Sit quietly for about 5 minutes before measuring, and then pay attention to what you ate, what you drank, what you were doing, and how you feel. Okay? Because all of those things can affect your blood pressure. All right, I hope that helps. So in the next episode, we're going to be answering another important question, which is, can you get off blood pressure medications? And if you have questions, go ahead and drop it in the comments. And don't forget to hit that like and subscribe button. And we're going to go ahead and, go on with the next, we'll see you next time in the next episode. So I hope that has helped.